Welcome to OneMed Pro Pulse, the podcast that unpacks global healthcare trends, digital health innovations, and key industry updates. It's everything happening in healthcare, made simple. Healthcare simplified.
Welcome to the deep dive. We cut through the noise, get straight to what matters. Today, we're diving into something, well, truly life-changing. The constant evolution of life-saving medicine and the huge global effort behind it. It's a field where, every single step forward can literally be the difference between life and death. It's quite profound when you think about it. So what's our focus today? Our mission is to give you a really crystal clear picture of a major international event happening in resuscitation science. It's called the World Resuscitation Congress 2025, WRC 2025 for short. We want to break down what this event actually is, why it's so important, and crucially, who really stands to benefit from being there. To do this, we've got a stack of sources, excerpts from global healthcare leaders, India Resuscitation Summit, a detailed event brochure, and a document about the senior faculty talks plan for WRC 2025.
And get this, what's really groundbreaking here, it's not just another medical conference. Not at all. This is actually the first time that global healthcare leaders from such an incredibly diverse range of fields are coming together in India specifically for resuscitation science. We're talking cardiology, toxicology, OBG, that's obstetrics and gynecology, orthopedics, so many more. It's a unique moment, really, a truly interdisciplinary push for global collaboration.
That's a fantastic point about the convergence. And who's actually pulling this massive event together? It must be quite an undertaking.
It really is.
The World Resuscitation Congress 2025. It's presented by the Indian College of Emergency Medicine, TISEM, and strategically organized by OneMed Pro. Plus, there's major support from Meenakshi Mission Hospital and Research Center and Meenakshi Super Specialty Hospital, both in Madurai, and, a whole host of global educational institutions and associations, too. It really shows that collaborative spirit, doesn't it?
Exactly. That backing is key. And the dates for this landmark event, it's set for December 4th to 7th, 2025, and the location, as you mentioned, is Madurai, India.
Madurai. Now, that's not just a random pin on the map for a global medical event like this, is it?
Oh, far from it. Madurai is, it's more than just a location. It's a 2,500-year-old cultural capital of Tamil Nadu, one of India's most historic cities. Its strategic position kind of blends this incredibly rich, ancient heritage with modern, rapidly growing healthcare infrastructure. So it becomes this perfect gateway, for knowledge exchange between the global experts coming in and the Indian medical community, which is vibrant and evolving itself. The brochure calls it a global gathering in a timeless city. I think that captures it perfectly. It bridges tradition and cutting-edge science.
A timeless city.
Oh.
I like that. Fostering a global gathering. And that global reach, it isn't just about the location, right? The scale of participation sounds immense.
It really is.
We're talking about people from over 25 countries participating, and they're expecting over 2,000 delegates and faculty?
That's the projection, yes. 2,000 plus.
And the brochure paints this picture of global faculty stretching from Tokyo to Toronto, Sydney to Stockholm. I mean, that represents the absolute best in emergency medicine, resuscitation science, trauma care, disaster response.
The whole spectrum.
It really sounds like a worldwide intellectual melting pot.
Precisely.
So with all this global expertise converging, who should be circling these dates on their calendar? Who is WRC 2025 really aimed at?
Well, the invitation is actually remarkably broad. It's designed to include pretty much anyone involved in that chain of life-saving care. So you're looking at senior doctors, resident doctors, nurses, paramedics, and even students, both undergraduate, the UGs, and postgraduate, the PGs. Basically, if your work involves saving lives, this event has something for you.
That makes a lot of sense. So the organizers use this phrase, resuscitation is a sacred duty. How does this Congress actually help medical professionals live up to that? What's the core mission here?
They've put it very clearly. The mission is to advance the science and practice of resuscitation. And this isn't just about small tweaks. It's about a collective goal bringing together all these different perspectives to really significantly improve life-saving techniques. Across the board, it speaks to that deep moral imperative behind the work, bringing the best minds together for this shared purpose.
Okay, so that's the big picture, the inspiring mission.
Right.
But let's get practical. For someone actually attending WRC 2025, What are the tangible takeaways? What kind of aha moments can they expect, things they might not get elsewhere?
Oh, the practical benefits are huge. First, you're going to get those genuine aha moments because the conference tackles resuscitation from so many different angles. Like we said, cardiology, toxicology, OBGYN, orthopedics. This multi-specialty view means an insight from one area might just spark a breakthrough in yours.
Cross-pollination, essentially.
Exactly. Second, you get access to cutting-edge knowledge, the very latest in resuscitation science across diverse populations, different clinical settings, various health systems. It's the forefront. And third, the networking. I mean, imagine connecting face-to-face with national and international faculty, leaders from over 25 countries. It's a massive opportunity to build your professional network globally.
That networking aspect alone sounds invaluable. So connecting this back to the actual content, how are the core pillars of resuscitation science covered? What specific areas will people learn about?
The program really goes deep. It covers cardiopulmonary resuscitation, CPR guidelines, and techniques. Everything from bystander actions right up to advanced provider care. Updates there are critical. Then there's a major focus on advanced life support protocols. ACLS for adults, PALS for kids, those standardized frameworks for emergencies. Staying current is vital. They also hit trauma resuscitation and pre-hospital care hard, looking at new interventions right at the scene or during transport. That's especially key in places with varied resources. And they don't just focus on the what, but also the how. So resuscitation education and training is big, innovative teaching, simulation, digital tools. How do we get better at teaching this stuff?
Makes sense. Training is key.
Definitely. And then there's technology and devices, looking ahead at the future of resuscitation, smart AEDs, wearable monitors, systems that give automated feedback. Quality and systems improvement gets attention too, through case studies and looking at frameworks for better patient outcomes overall. And something I think is particularly insightful is the focus on ethical decision-making in resuscitation.
Ah, yes. The tough stuff.
Exactly. Real-world dilemmas, end-of-life decisions, advanced directives, consent, how to involve families, really important conversations. And critically, they focus on resuscitation in special populations. Neonates, kids, older patients, people with chronic conditions or disabilities, even toxic exposures. Each needs a nuanced approach.
Right. Not a one-size-fits-all situation.
Not at all. Plus, specific deep dives into things like neuroemergencies and toxicology, recognizing those early is key. And maternal and obstetric emergencies, hemorrhage control, arrest management, trauma during pregnancy, it's incredibly comprehensive.
Wow, that really covers the whole spectrum. But crucially, it sounds like it's not just about listening to lectures, right? Are there hands-on practical learning opportunities?
You are absolutely right. The way it's structured, the formats and activities, they're really varied and very practical. Yes, you'll have your keynote presentations from top national and international faculty, and talks from younger faculty, dedicated senior faculty talks too. There are abstract presentations, oral and posters to quiz, which can be fun, and awards, including leadership awards. But what really jumps out, I think, are the workshops. Over 20 hands-on, life-saving workshops. That's where you really get stuck in.
Over 20 hands-on workshops. Okay, that's not just passive learning, that's active skill building.
Yeah.
Can you give us a taste? Any specific workshops or sessions that really caught your eye as being particularly innovative or maybe essential?
Absolutely. Let's pull out a few just to give you a flavor. So on day 2, that's December 5th, some of the workshops, there's a pediatric emergency simulation, vital for practicing high-stakes scenarios safely.
Right, sim labs are invaluable.
Totally. Then toxicology emergencies covering antidotes, decontamination. It's more common than you might think and often complex. There's an ED procedures masterclass, great for sharpening those practical skills. And get this, a communication masterclass specifically on breaking bad news.
Oh, wow. That's incredibly important and so difficult.
Isn't it? An essential skill, though.
Yeah.
And for a broader view, there's a disaster medicine and pre-hospital drill with a mock triage, putting theory into practice for mass casualty events.
Okay, those workshops sound intense and incredibly useful. What about the main conference sessions? Any highlights there?
Yeah, looking at the main sessions, day 1, December 6th, in Hall A, for example, topics like critical care in ED and ventilator troubleshooting for the resus clinician.
Oh.
Super practical stuff that impacts daily patient care.
Directly applicable.
Exactly. And the ethics and debate session sounds fascinating. They're tackling really provocative questions like family presence, pros and pitfalls, the whole issue of having family in the room during resuscitation.
That's a huge debate in itself.
It is. And they're asking, should all EDs have ECMO capability? ECMO, that high-level life support. It's a massive resource question.
Absolutely. Resource allocation is always tricky.
And another one, is intubation overused in pre-hospital settings? Challenging current norms, looking at alternatives. These debates should spark some really important discussions.
They certainly sound like they will, hitting on real current challenges. And day 2, any key sessions jump out?
Day 2, December 7th, looks equally strong. Hall A and B have sessions on obstetric and maternal emergencies, so crucial for moms and babies, and EMS and pre-hospital, focusing on that first vital link in survival. And looking ahead, there's a session on AI, digital health, and teleresis, exploring how technology is literally changing how we deliver emergency care, even remotely.
So really bridging current practice with future innovation.
Precisely. The breadth is just, astounding.
Now let's shift gears slightly. For the leaders, the innovators listening, there's this senior faculty talk session. It sounds like a major platform for established experts. What kind of cutting-edge ideas are they hoping to showcase there?
Right. This is where you really see the future of resuscitation being shaped. The suggested topics are seriously forward-thinking. Things like advanced resuscitation strategies, maybe even pre-hospital ECMO. Imagine initiating that level of life support before reaching the hospital. Huge implications.
Wow, that would be a game changer.
Wouldn't it? They're also looking at things like lipid emulsion therapy for certain toxic overdoses, a very specific targeted intervention. And importantly, moving beyond just the immediate crisis, they're delving into post-resuscitation psychiatric care, recognizing the long-term mental health impact on survivors. That's often overlooked.
That's so important, the follow-up care.
Critical. And then, looking at training again, how VR and AR, virtual and augmented reality are revolutionizing how professionals learn and practice these high-stakes procedures.
A really impressive range of potential topics. So if someone listening is a senior clinician, a researcher, an educator, what are the criteria to actually apply to be a senior faculty speaker at this event?
Yeah, it's definitely aimed at the top tier. This is for senior clinicians, researchers, educators who have recognized expertise in resuscitation or related specialties. You need to have proven, significant contributions, whether that's in clinical practice, research, innovation, education, or public health related to resuscitation. They're looking for the real leaders shaping the field.
Okay, high bar, as expected. And if someone fits that description and wants to share their work, how do they apply? And what are the benefits for them?
The process seems straightforward. You submit a nomination or a proposal, needs the title of your talk, 2-3 key points or an outline, and a brief professional bio, about 100-150 words. Send it all to info@wrc.org.in. And the deadline is August 31st, 2025. So there's still time, but definitely something to get on soon.
Good to know the deadline. And the benefits. Why should a senior leader take the time to do this?
Oh, the benefits are significant. First, it's an unparalleled global platform. You get to share your expertise and really influence the next generation. There's a unique opportunity to mentor younger faculty, shape where the field is headed. Huge academic recognition comes with it. You'll network with international leaders at the very highest level. Your work gets included in the official conference proceedings. And of course, high visibility among thousands of delegates from all over the world. The call to action they use sums it up. Lead the way in resuscitation science. Share, inspire, transform. It's a real chance to make a mark.
Okay, so wrapping things up, WRC 2025 sounds like it's going to be this incredible, unique meeting point for global resuscitation science. Just a really comprehensive experience for learning, for networking, for leadership. Bringing together the best minds to genuinely move life-saving techniques forward on a global scale.
Absolutely. And that's exactly why understanding events like this matters for you, the listener. It keeps you informed about critical global health initiatives, about the future of life-saving medicine, regardless of your specific background. Knowing about these advancements helps you appreciate the momentum behind medical progress and, well, what it means for all of us.
So here's a final thought to leave you with. Given all these rapid advancements we've discussed and the complex ethical questions being debated at WRC 2025, how might the actual definition of resuscitation change in the next 10 years? And maybe more personally, what role do you see yourself playing in that future?
And just so you know, this deep dive you've just listened to, it's actually the first part of the WRC 2025 series right here on the One Med Pro Pulse podcast. One Med Pro will be bringing you more talk series focused on WRC 2025. So definitely stay tuned for more insights as we continue to unpack this really pivotal event.
Thanks for tuning in to One Med Pro Pulse. For more insights and updates, visit onemedpro.com, your partner in healthcare innovation. Don't forget to subscribe and share.